I was a trans kid. I hated my body. I was convinced that I was a boy. Thankfully, my school psychologist did not affirm my trans identity, because it turns out my trans identity was a coping mechanism that resulted after a brutal sexual assault.
When I was 9 years old, I was raped by one of my father's employees, which caused a lot of confusion in my mind. I would ask myself, why do men want to have sex with me?
And I am not alone.
I came out as trans when I was 14, and I had just gone through a very traumatic sexual experience. I wanted to change my gender after that happened.
Many others are coming out and talking about their experiences and the ultimate cause of their trans identity.
Without going into it, I have a history of childhood trauma that contributed and still contributes to feelings of dysphoria and dissociation and total just disconnect.
And it turns out a trans identity is not a normal developmental path, but often a coping mechanism as a result of a severe trauma.
That underneath, in my case, was trauma. And I now know that I had complex post-traumatic stress. There are a huge number of people, I think, and I don't mean this disrespectfully, who do use, like me, gender transition as a form of escape. And this is what I came to realize. I was escaping my pain. I was disassociating from my own identity.
And there are other things that cause it as well. Sometimes a child perceives that their parents prefer the other sex, so they do everything they can to become that other sex to please their parent. Sometimes children are just confused about gender roles. Sometimes a child might be told that a woman like me with short hair is really transgender. So there are lots of reasons why kids develop a trans identity.
Trauma. I think my transition was a result of childhood trauma. It was a plethora of experiences that told my subconscious that I wasn't right being female.
We are doing a huge disservice to children when we affirm their trans identity.
And then in the 6th grade, when I was on the Summer League swim team, and we had a new diving coach. Well, what he would do is, when he had a chance, he would play with me. He would fondle me.
So please, when you hear people talk about transgender kids, and you want to be compassionate and loving to them, the compassionate and loving thing is to question this narrative and to allow these children to have the therapy that they need to uncover the cause of their transgender identity.
Keep in mind, 100% of the people that I work with have had serious psychological disorders that they need help for.
Today, certain groups of children are being diagnosed with or claiming transgender identities in very disproportionate numbers. These include children of color, children residing in foster homes, children who were adopted at the rate of about 3 times greater incidence of transgenderism, children with a prior history of psychiatric illness, children with mental developmental disturbances, children on the autistic spectrum, which are identified as transgender at a rate demonstrated on 2 continents at 7-fold the incidence of non-autistic children want to be transgender people or claim to be transgender people. And while 20 years ago, the large majority of individuals identifying as transgender were biologic males,